Welcome back to Angel Vinny Nursing tutorial. In this video, we are going to study about the medical surgical nursing. So, what is the medical surgical nursing? So, you will be thinking that what is the medical surgical nursing? So, that is nothing but medicine means is a science which diagnose and treat the disease by the drugs. So, medicine means which is a science and which diagnose and treat the disease by the drugs. So, that we can call the medicine. Okay, so what do you mean by surgery? Surgery is a branch of medicine. So, it is a branch of medicine that deals with the diagnosis, treatment of injury. So, what is medicine? Medicine means is a science and which diagnose and treat the disease by the drugs. So, by the drugs, we will treat, diagnosis and treat the disease is called a medicine. And surgery means it's a branch of medicine that deals with the diagnosis, treatment of injury, deformity by manual and instrumental by an operation. So here it's a branch of medicine that deals with the diagnosis, treatment of injury, deformity by manual and instrument by an operation. So different types of surgery can be done to provide relief. So different type of surgery we can see in here. So that is a definition of the surgery. And last one is nursing. Nursing is a science which diagnoses and treat the actual potential or nursing problems by nursing skills and care. So that is a nursing. Nursing is a science which diagnose and treat the actual or potential nursing problems by nursing skills and care. So this is about the medical surgical nursing. Let's move to the types of surgery. So, what are the types of surgery we are we are facing here? So, most surgical procedures are performed in a hospital operating room. Surgical procedures means which is mainly will be performed in a hospital operating room. Although many simpler procedures is carried out in the surgical centers and ambulatory surgical unit. Surgical procedures are commonly grouped according to here there is a two major things, two main points are here means surgery mainly we can say that is a major surgery, minor surgery. So when you are going to the hospital, there is a major surgery and the minor surgery. Minor surgery. Major surgery means we can say it should be very sterility and these all the things is appendicitis, all those things will become. Minor means is a wound injury, wound closure, no wound injury. These all the things will be coming. That's a minor surgery can do in casualty, the emergency room. No? So they can do conduct the emergency room these surgeries and major means it should be in the OT. See here, let's see the here this is according to the this one purpose is surgery. So some of the criteria they are maintaining according to that how they divide they group the types of surgery. Let's see one by one. So that is first one is that is criteria the, according to the purposive surgery. So first one is diagnostic surgery. This is an operation in which diagnosis is unknown, so it is confirmed or established as diagnosis. Example, exploratory laparotomy in which the abdomen is open to seek the cause of symptoms or biopsy of the mass in the breast. Okay, so here first one is what is that? Diagnostic. Diagnostic, we doesn't know what is the reason, what is the problem, what is the causative organ, so what is the reason why the person is having the problem. So what we will do? We will do the diagnostic surgery. So that first one, diagnostic surgery. So to confirm what is a diagnosis, what is a problem, we will conduct the exploratory laparotomy. Laparotomy means it's a opening that abdomen to seek out the causes, the biopsy of the breast. Mainly, we will be conducting or this will conduct this one in the breast cancer. Breast cancer patient, so they will conduct the surgery. And next one is a palliative. I hope you guys heard about the palliative. This is an operation in which the symptoms are relieved, but basic cause remains and so does not cure the disease. Example, resection of the nerve root or insection of the gastrectomy tube to compensate for the inability to swallow. Some so the symptoms is okay, it's relieved, but then also something it is missing. Like what? It's something what will be we are not understanding what is the exact cause of the this one patient. So we will conduct the resection of the nerve root. So that resection of the nerve root has done, but again, so they will insertion of the gastrectomy tube to compensate to for inability to swallow. The patient is not able to swallow. Why? That doesn't know the cause. So that they will conduct the surgery. That is a palliative surgery. The next one is ablative. Ablative means this is an operation in which disease by the part is removed. Ablative means it's a part is removed. The meaning is removed. Okay, the part is removed. So that is example of the gallbladder. I hope you heard about the gallbladder. So the gallbladder, it's filled with the stones. Gallbladder stones will be there. Because of that, it get infected, then it will removed. So what will we do? So that surgery we used to call it a bloody surgeries because of the part, the removal of the gallbladder. And next one is the reconstructive or cosmetic surgery. Reconstructive or cosmetic surgery. So here so I hope you guys is knows about the cosmetic surgery. So they will conduct the mainly this surgery will be do the film stars all the VAPs. Okay. So this is an operation in which done to restore the function and restore appearance that has been lost or reduced. Example, mammoplasty and breast implant and facelift, lift, etc. And repair of cleft lip and cleft palate. Okay, so that is also reconstructive surgery. Repair of the cleft lip and cleft palate in mammoplasty. So they will put something like just foreign material. They will keep it in the breast. So that is a enlargement of not a large. It shows some beauty for that. So they will keep it and that breast implants all the things. And so that is about the cosmetic surgery. And next one is the transplant and the corrective. And transplant means this is an operation in which deformities are corrected and malfunctioning structures are replaced. Example is hip replacement, replacement of the mitral wall. So they will take it out. Transplant means they will correct it and they will take it out the which is a malfunction, which is not working. So that is called a transplant. And next one is the curative. And curative means this is an operation in which complete cure is ensured by removing the diseased part of the organ. So they want that complete curing of the diseased part of the organ. So in that surgery, example, removal of an inflamed appendix. That appendix, no, so which is inflamed, so they will remove the complete this one appendix. So the total extension of the tumor mass. Next one is the reparative reparative surgery. So in that this is an operation in which repair the damaged or injured part of the part is done. That is suturing of multiple wound. Suturing of multiple wound. So they will repair again the wound they suture which is not correctly which is got infected again they will suture in the multiple wound. Then restore it. That means this is an operation involving strengthening of a weakened area that is a hemeroheavy. Hemeroheavy means so that is they will strengthen the weakened area, they will conduct the restorative. And you will study that later what is that. Then preventive operation means is performed to prevent the disease by removal of molds to prevent it turned into malignancy. Small molds will be there that will turns to what cancer, so they will conduct the preventive surgery. So these all are the surgeries will be coming under the purposive surgery. So what are the things will be coming under the purposive surgery? Diagnostic, palliative, ablative, reconstructive, transplant, and curative, reparative, and restorative and preventive. So, 9 things will be coming under the purposive surgery. So, let's move to the degree of urgency. So, first we have seen the surgery, purposive surgery. Next is move to the degree of urgency. So next move to the degree of urgency. In that degree of urgency, first one is a immediate. First one is a immediate. So that means without delay. Without delay, the surgery is performed immediately to preserve functions or save life of the client. Example, ruptured aortic aneurysm. Have you heard about the ruptured aortic aneurysm? That this one will be this one break. Okay, that blood vessels, no. So aneurysm will happen. So aortic aneurysm will be that aneurysm it will be break, and so what will be? It is a dilatation of the blood vessels, and which will be break, rupture, then gunshot wound, and epidural hematoma, acute appendicitis. So those cases we should give the care. We shouldn't delay this surgery. It should and very soon have to undergo the surgery. Next one is the emergency. Pre-operative and period is very short and because the life-threatening situation, example, acute appendicitis, therefore minimum preparation can be done to preventive period. So acute appendicitis also that is a very that is emergency. And last one is the urgent. Urgent means client required prompt attention. Surgery is performed within the 24 to 48 hours. Example, urethral calculi, bleeding uterine fibroids, and obstructed duodenal ulcers. So these kind of things. What is the immediate? Immediate means without delay that a person should get that surgery. So that is immediate. Example, ruptured aortic aneurysm. Emergency means a pre-operative period is very short. Pre-operative period, that means before the surgery, that is a pre-operative period is very short and need more it is a life-threatening condition and need the surgery very soon. And urgent means client required prompt attention. Surgery should be within the 24 to 48 hours. That is a degree of urgency. And the types of surgery. And next one is the third one is the elective or planned. Have you heard about elective or planned? Planned means we know. So that is we planned. Elective means or planned. So that we will study. The surgery is performed when surgical intervention is preferred. Treatment for the condition that is most immediately life-threatening. Time for surgery is fixed with the mutual consent of the surgeon and the patient. This is enough time left for the pre-operative care to be given to the patient. So here they are already planned and they have taken the consent from the patient and the surgeon. So surgeon also has written the consent and they have taken this consent from the patient. So that is most immediately life-threatening conditions they will do this kind of things. So what are the things is coming under that? That is first one is required and recommended and optional and cosmetics. So that first is what is the required? Required means surgery is required within the weeks or months. So that elective surgery also it is have some of the criteria. So that is that the surgery is required within weeks or month. Example is cataract extraction, cataract surgery, right? So that is the required surgery. Benign prostatic hyperplasia and chronic cholecystitis. So benign BPH in males will be having the BPH, chronic cholecystitis. So those is required within a week or month has to conduct the surgery. So that is a require. Next one, recommended. Client should be operated upon. Failure to do the surgery is not uh, catastrophic. Example, simple hemorrhoids, rectosil, cystosil, simple hernia. So these and all clients should be operated upon. Failure to do surgery, it's not, it's catastrophic. So recommended. So they will recommend you can and you can do this surgery. So they will, doctors will be recommend. It's very important. So they will recommend. So plan that whenever you will be do the surgery. So that will be good, and they will recommend the surgery. And is optional or cosmetics. So decision rests with the client and is a personal preference of the client. And the plastic surgery procedures as facelift. So they will give the optional whenever you want. You can do. This is the elective or planned. So what are the things will be coming under that? The required, that means within the week has to do, and this one cataract surgery recommended client should be operated upon. It is clients upon failure to do the surgery or not. It is clients, and optional means they can do. That is a personal preference of the patient. So that is the elective or planned. And next one is the degree of the risk. So that degree of the risk, that is the surgery we can classify it under the major and minor. So we can classify it into major and minor. So let's see one by one. So what is a major surgery? So here the major surgery. The major surgery requires hospitalization. Obviously, it's near the hospital. Patient should be hospitalized. It's usually prolonged and carries a higher degree of the risk, and this involves a high risk degree of risk of to the client, involves the major body organs or life-threatening situations, and has the potential of the post-operative complications. So here so it carry the higher risk degree of the risk. Risk it will be very more, and it involve the high risk of the risk of the client, involve the major body organs, life threatening. It will be very life threatening problem. Potential of the post operative complication after the surgery. The patient having post operative after the surgery, they have the complication, and it may be complicated, prolonged. There may be heavy blood loss, and vital organs may be involved. Post operative complications likely, and operations may involve large surface area of the body. Example, open heart surgery, organ transplant, and removal of the kidney. So these all the things will be coming under that, where the large, the major major surgery. So what are the things is major surgery? So the patient should be hospitalized, then it should be prolonged procedure, carry high risk, degree of risk, and it involve the major body organs and life threatening. Then it will be have the post operative complication. What are the this one? Surgeries are open heart surgery, organ transplant, and removal of the kidney. So these are the things will be coming under the major surgery. So next move to the minor surgery. So minor surgery means this is normally involve the little risk procedure, produces the few complications, and usually involve a small area of the body. Example, breast biopsy. So they can conduct the minor surgery, tonsillectomy, removal of the tonsil, and it may be performed in the OPD section, outpatient department. They can conduct these kind of procedures, and same day surgery settings in the operating suites of the hospital. They same day, so they will conduct the, so when the patient go to the hospital at the same day, they will conduct the surgery. So what all the things is minor surgery. So we have finished this degree of the risk, and let's see the suffix describing the surgical procedures. Okay, before that, let's this one. We can summarize all the things. What are the things we have studied? We have seen that the types of surgery, right? In that purposive surgery, we have studied degree of urgency and elective or planned and degree of the risk. And next, we will move to the suffix or describe the surgical procedure. I hope you heard about some of the terminology that is a medical terms or medical words. So let's see. What is the ectomy? Ectomy means, have you heard about that ectomy? Excision or removal. So that is a meaning, excision or removal. That is myectomy. Myectomy. Ectomy means it's a removal. What is lysis? It's breakdown or destruction. So electrolysis, phagocytosis, then embryolysis. Its lysis is destruction. Oraphy. Oraphy means it's repair a suture. uh, Colporaphy, herniorrhaphy. So that is the herniorrhaphy. It's a suture in again the repairing. Ostomy, creation of opening into. They make the opening. That is a colostomy. Opening the colon. Colon means it's a large intestine. Ostomy, otomy means cutting into incision. So otomy means tracheostomy. They will cutting and they will do the incision. So that is the otomy. That is the ostomy, otomy. The plasty means repair or reconstruction. Tympanoplasty. Then cranioplasty. Have you heard about the cranioplasty? So that is in the brain. They will do. That is in the head. Head injury patient, no. So we'll conduct this cranioplasty. So this is the some of the surgical this one procedures suffix you should be keep it in mind. Ectomy, excision or removal, lysis, destruction, oraphy, repair a suture, ostomy, creation of opening into, ectomy, cutting into incision, and plasty is repair or reconstruction. Next one is a surgical team. So what are the or who all are coming under the surgical team? Have you heard about the surgical team? Yes. Yeah, surgical team means the surgeon, anesthesiologist, anesthet or the scrub nurse, assistant circulating nurse, then will be coming under the surgical team. Surgeon will come, anesthesiologist, anesthetist, scrub nurse, and circulating nurse. Who all are will be coming? Surgeon. So that is one surgeon, anesthesiologist or anesthesiate, and scrub nurse, assistant or circulating nurse. So in that surgeon, no, so a major surgeon will be there, major, then assistants will be there. One or two will be there. Maybe two will be there. Anesthetist, there is a this one will be senior will be there. Then they have one more junior. Okay, so all those will be coming under this one. Then what is the anesthesia? Okay, so anesthesia is a state of, so you should know what is anesthesia. So here the anesthesia means it's a state of narcosis is used to produce unconsciousness. So they will use the narcosis to produce the unconsciousness, analgesia, muscle relaxation, reflex loss during the reflexes lost during the surgical procedure. During the surgical procedure, they will give the anesthesia, that is a narcosis used to produce unconscious. Patient should be unconscious, and analgesic, muscle relaxation, and reflex loss. And anesthesia involved the use of medicine to block the pain sensation during the surgery and other medical procedure. Anesthesia also reduced the many of the body's normal stress reaction to surgery. There are various forms of anesthesia. The type of anesthesia will be depend on the type of surgery, medical condition. This different type of anesthesia may be includes, so different type of anesthesia will be there. The anesthesia will be reduced as the many body normal stress reactions of the surgery. They will reduce the pain and reduce the body normal stress. So let's see the types of anesthesia. Normally the main thing is general anesthesia inhalation, that is anesthetic intravenously given, IV given, that is general means full body anesthetic. Analgesic, there is no movement. Then local anesthesia will be spinal to the spinal. So that is spinal means in the lumbar will given means the lower body will be anesthetic. Epidural. It's anesthetic given to the epidural space and local nerve infiltration. Only the hand surgery, only the one hand has to be this one. Then they will give the nerve block infiltration. Surface or tropical. Only you will go for the dental this one. No? So they will give the surface or topical lignocaine they will give. So that is the type of anesthesia in a short. So we have seen that anesthesia. Let's move to see the some of the definitions. What is anesthesia? So these all the definition is very important. You should keep it in mind. Okay, anesthesia means a partial or complete loss of sensation with or without loss of consciousness as a result of disease, of an injury or administration of a drug. Okay, so what is anesthesia? It's a partial, complete loss of sensation with or without loss of consciousness as a result of disease, an injury or administration of drug. So that is the anesthesia. It is a complete loss of the sensation. We won't get partial or complete loss and with or without conscious. Sometimes the patient will be conscious and sometimes it's not conscious. And because is there any under surgery or disease or giving the drugs? Okay. Then what is a cyanosis? Have you heard about cyanosis? A Greek word for slightly bluish gray or purple discoloration of the skin due to deficiency of oxygen and excess of carbon dioxide in the blood. So that is a deficiency of oxygen and the excess of carbon dioxide in the blood. Then that is, we can say the bluish discoloration of the skin. So that is a cyanosis because less amount of oxygen in the body skin will lead to bluish discoloration. So because more carbon dioxide will be there. The next one is the narcotics, a group of drugs producing stupor, sleep, and complete unconsciousness used to allay pain and narcotic are regulated by federal laws or NPO. So here they will produce narcotic produce the stupor and it will be feeling sleepy, complete unconsciousness and pain relief. So those things, those drugs we can say is narcotics. What is the perioperative period? The period extending from the time of hospitalization for the surgery to the time of discharge. Perioperative period means when the patient enter the hospital from the that one to the discharge, we can call it is a perioperative period. What is the preoperative phase? The phase of the perioperative period during the admit the patient in the surgical unit and help the individual prepare and physically and emotionally for the operation. So before the operation, when the patient enter the surgery to before the operation, that phase is called a pre-operative phase. Then during surgery, now that we used to call it is intraoperative phase. Write it here. Pre-operative phase, then that is before surgery. Next one is the intraoperative phase, that is during surgery. Last one is the post-operative, that means after surgery. Okay. Then next one is the prosthetics. Prosthetics means an artificial organ or the part, or example, artificial limb, eyeglasses or dentures, we can say that prosthetics. Artificial organ or the part, will keep it in. Maybe like this artificial limb, eyeglasses and dentures, we can say is prosthetics. And thrombophlebitis, inflammation of the vein associated with thrombus formation. What is mean by thrombus? Is a blood clot, is a thrombus, blood clot. Clotting blood, we used to call it is thrombus. Thrombitis means thrombophlebitis, infection of the vein associated with because of the thrombus formation. Thrombus formation, the vein will be infected. Thrombus means a blood clot. Thrombus means blood clot. So these are some definition of the medical words. You should know this. We should by heart it. So this is about the introduction of medical surgical nursing first thing. So I hope your student understand this class. If you have any doubt, please comment below. Then thank you for listening, all of you.